work. So please welcome Hanaa and David. Thank you.
Can I just, Jason, I want to thank you for the work that you do and for the story that you shared. I was nervous too on my way here, but then when I heard you, I was just like, oh my God, like I have all these emotions, you know. I don't think anyone is absent of grief. But then when you said it, I just, I started to feel it in my body. It's not a bad thing. I think recognizing it and owning it is part of the solution. And speaking of solution, we're here today to talk about big problems and practical solutions in nature. Thank you so much for being here. I am thrilled to be on stage to talk about my favorite things, nature, health, solution, surrounded by all great people. One of the most brilliant and kind people that I know. And just let me just say, the book came out last year, and I've used it to teach my medical students, and I'm going to share with you what one of them says. And so a little disclaimer before we start is Jesus mentioned that I am a visiting scholar at the Federal Reserve Bank of New York. So anything that I say today does not represent the bank and has no bearing or association with the bank or the system itself. Today I'm here as the vice chair of Children Nature Network, the board of directors, and as Hanaa, a practitioner, a researcher who deeply understands and knows the transformative power of nature on health of humans, particularly children. So, but before we get into the discussion with David, I'd like to kind of frame our conversation this morning with some sobering numbers, particularly about how much in America we spend on healthcare, or it's a lot of my students would say sick care. According to the Congressional Budget Office, in 2022, we spent 17% of our GDP on healthcare. That is about $4.5 trillion, and it equates to $13,500 per person. This is the highest percentage of GDP spent on healthcare among developed countries, and is significantly higher than any other member nations of the Organization for Economic Cooperative and Development, such as Germany, France, and Japan. We are also, we have the higher public and private healthcare expenditure than any developed countries. This year alone, we're projected to spend 6.3% of our GDP on healthcare, and the Congressional Budget Office also predicts that our federal spending in just a decade from now, 2054, it's going to be 10%, right? And 90% of the nation's expenditure, that 4.5 trillion, is spent on chronic illnesses. That's 90% of preventable expenditure. These numbers are daunting and makes absolute no sense, right? Particularly because we know how to reduce the 90%. We have brilliant models and books, one of which we'll hear from today, to show us and tell us where to spend for better health and well-being. From one of these models, actually, something that was developed right here in Wisconsin, Madison at the university here, which is the County Health Ranking Measurement Model. We know from that that two of the health indicators for good outcomes, how well we live, our quality of life, and how long we live is mostly determined, about 80% of that, is determined outside of exam rooms and hospitals. If we disaggregate that number further, we know that more than 50% of our health is influenced by social and economic factors and physical environments. This is education, employment, community safety, and social connection in the environment's both green and social infrastructures. If we pay attention to these models, we could actually invest in the vital conditions that lead to longer and better health. Today, we're here to hear from one of the most prolific writers, I think, in this area, David Erickson. And he's going to tell us how we can invest in vital conditions, as he brilliantly writes in this book called The Fifth Freedom, Guaranteeing an Opportunity-Rich Children for All. Before I let you get into that discussion, David, I would like to take a couple of seconds to share with you a review that resonates really well with me and certainly many of my medical students. And the review says, written with empathy, precision, and deeply informed historical analysis, Erickson issues a clarion call for America to fundamentally rethink how it serves its citizens and enables the next generation to flourish. The Fifth Freedom shows that it is possible and necessary to think big, to spend well, and restore health and economic security to all people in all places, an essential read for policymakers, but all citizens alike. And this came from Margaret Omer, the author of The Code, The Silicon Valley and Remaking of America. What I would add to that, and this came from one of my medical students, I teach at Rutgers. It's an advanced honors program that integrates medical education and another field. And mostly I teach at the intersection of social epidemiology and architecture and urban planning. And one of my students says, we didn't expect you to sign a book that was radically, radically practical. Right? It is engaging. It has a lot of history. It has philosophy. It has data. But most of all, it really invites us to stop thinking linearly and envision a healthier future by just making small shifts and not spending $4.5 trillion in sick care. With that, I'd like to turn over to David and say thank you so much for being here with us. And if there's anything that you want to start before we get into the questions.
Sure. So thank you so much, and thank you all. Thank you for having me here. I've learned a ton over the last couple of days. Let's just jump in.
All right. So question one, so simple. I actually asked my students, what would you ask? They're like, do not corner him and ask him for details. So, simple but not so simple. What inspired you to write The Fifth Freedom?
Well, the first line of the book is that the status quo is stupid, unfair, and expensive. And did I mention that these views are my own and not representing the Federal Reserve Bank of New York or the Federal Reserve System? But these are my own. I'm speaking as a citizen here. But it's just really frustrating. I mean, Hanaa, you gave the numbers, $4.5 trillion. 90% of that is for chronic disease and mental health treatment. Most of that is avoidable. So, and our estimation is that about $1 trillion of that is treating the disease that is the byproduct of living in poverty. So it is literally the stupidest thing imaginable that we're willing to spend $1 trillion. And I have a PhD in U.S. history, so I'm not a numbers person, even though I work with banks all the time. And but $1 trillion, that's $1,000 billion a year that we could be spending upstream on the social determinants of health or the vital conditions for thriving. And there's got to be a way to make it work. You're right. So that's what the book is really about. I was really inspired by the speaker yesterday talking about that discussion around what's an elephant worth, right? And under one lens, the elephant's worth what you can saw the tusks off for and sell. That's a value of the elephant. But when this one law review article came out, she was saying how if you look at it more holistically, there's the elephant's role in the herd and how it helps the other elephants thrive and that whole ecosystem thrive. And that is a draw for ecotourists that come in. And under that scenario, the elephant's worth millions of dollars. And so that's really kind of what inspired the book, and some thinking was, what would it look like to have a population health business model? What would it look like to spend that $1 trillion upstream to make sure kids thrive rather than downstream on the consequences of not doing that in the first place?
I told y'all, he's brilliant. More to come. And then next question is, what does the fifth freedom mean? Let me just clarify. What does the fifth freedom, guaranteeing an opportunity-rich childhood for all, mean?
Sure. So so that it's the problem. I mean, in some levels, everything's more complicated than it appears, and so I spend a lot of time trying to kind of simplify things or find ways where we can get to solutions and try to explain things. It's interesting that this was not my title for the book, by the way. Like the Brookings Institution published the book, and they didn't touch one of the 50,000 words in the text, but they said the title I had was guardrails and airbags. This is my idea of like how you can kind of help to make sure kids get into adulthood and thrive. And they're like, no, that's too tactical. What's the goal? What's the objective? And I did write about this fifth freedom in the introduction, so they took that out and made it the title. But it was January 1941. January 1942. Franklin Roosevelt is addressing Congress, and it's a very dark time. I mean, the armies of fascism are scoring victories all over the globe. It is a dark moment for humanity. And Roosevelt's trying to rally the country to say, look, fascism is on the rise. What liberal democracies need to rally and oppose that. What are we fighting for? And he said, we're fighting for the four freedoms. And there was the freedom of speech, freedom of religion, freedom from fear, and freedom from want. Those were the four. And freedom from fear and want are kind of, the first two are pretty straightforward. The second two are a little more complicated. But freedom of fear is this idea that you shouldn't have to fear about the secret police coming in the middle of the night, take you away. And countries should solve their disagreements through diplomacy, not war. Freedom from want is this idea that there's an economic underpinning to citizenship. So you might think about Martin Luther King's great observation that what is it worth to be able to sit at the lunch counter if you can't afford the hamburger, right? So everyone needs to have a living wage job. They should be able to support their families. The economy needs to be providing for them. But even with those four freedoms, if you think about those are all good. But even so, we look around, we still see. On my walk over here, I saw a lot of people struggling from the hotel that were on the streets of Madison, and you'll see that everywhere. And so what are we doing wrong? What if we had a fifth freedom, what would it be, right? And so to me, if I tried it, the one-liner is every kid should have a middle-class existence and get into the adulthood with the skills they need to thrive. And that sounds expensive, but it's actually cheaper than the status quo because we spend so much. There's that $1 trillion we spend on medical care, but if you add up all the incarceration, the lower tax receipts from people who aren't working to their full potential, there's 1.5 jobs going unfilled for every unemployed person. The economy is crying out for more qualified workers, and we're not producing them. And so there's a lot of money being left on the table that if we invest and take care of each other more effectively. So that idea of an opportunity-rich child for all is really based on this idea. And my husband's a pediatrician, and he worked for a long time in a low-income clinic in East Palo Alto. We were living in San Francisco at the time, and he says, he delivered a lot of these babies that he would see, and then he would see them again over the course of their well-child checks over the years. And it was heartbreaking because he could say, look, he says, we would do lab tests and things like that during those visits, But he said, I could look into their eyes and I knew what the lab results would be. And he's like, look, every one of those babies, I was there, they had bright eyes when they were born. Every kid is born to thrive. They're engineered to thrive. And he could see over time that those eyes would dull. And he knew they were going to be worse off and sicker. And so what do we need to do to keep bright eyes for a lifetime? There's got to be a way to do that. And I think you make sure every kid's got music lessons and trips to Paris to practice their French and trips into the wilderness to engage in nature, to sort of connect in those ways and find all the ways in which we can keep those eyes bright for a lifetime. And that's the business model. It's simple in that way, you know.
Where can we find like solutions that are working? Can you give us examples where cities or partnerships are investing in guardrails and airbags?
So there isn't a perfect example, unfortunately, but there are places that I think are sort of on the verge of tipping into this. And so I dedicate a whole chapter to Hawaii, for example. And Hawaii is a really interesting place. I mean, it's beautiful. It's a beautiful place. We associate it with kind of vacation and whatnot. But, you know, there's actually, and in that place, there isn't as much poverty as there is in the rest of the country. But there are a lot of low-income jobs in the tourist industry, and it's expensive to live in Hawaii. So the United Way has this measurement they call ALICE, Asset Limited Income Constrained Employed. And that's a measurement, almost half the population in Hawaii are ALICE. And they're really struggling, and some of their health outcomes are worse because of it. And they only have 2 health insurers. So there's kind of almost like a closed loop there. So there's 2 insurers that own the downstream medical care cost risk. And it was like, in one instance in particular, in Maui, Kaiser Permanente provides all the medical services for the island and most of the health insurance for the island. So they own the downstream medical care cost risk. And when that happened, they started investing in preschools because they knew that arriving at kindergarten ready to learn was one of the best predictors of future health, right? This is what's really hard to get your head around. Like when I was first engaging in this topic, I have spent 30 years in community development finance. So what I have done is focusing on investing in neighborhoods to make them more opportunity rich from an economic standpoint. And I remember my husband would always say, like, you know that has a health implication, right? And I'm like, no, it does not, you know, because in those days when I heard health, I thought medical care. And that's not what health is. Health is a state of well-being and not just the absence of disease. And the number one best predictor of future health for a child is not their body mass index, is whether or not they're reading at grade level. One of the most important indicators of health is not necessarily your blood pressure, it's whether or not you have a job. So these are the things that I think it took me a long time to learn that. But then when you start seeing it play out in a place like Hawaii, it starts to get you can see how it starts to benefit the downstream savings to a place to an insurer like Kaiser. And one example I really wanted to lift up to this group, and I write about it in the book, but in my estimation, they're sort of buyers of health, they're producers of health, and they're connectors that connect the buyers to the sellers. And one of the really powerful producers of health that I encountered in Hawaii is this group called the Ma'o Farms. And the Ma'o Farms is a effort in Oahu where they focus on native Hawaiian agriculture and native Hawaiian foods that they cultivate, and they also do some restoration of the environment in that area and across the island. Actually, they recruit almost primarily from an area called the Waianae Coast. That's the largest concentration of native Hawaiians in the Hawaiian Islands, and that's a very the health outcomes there are very poor, and there's a lot of poverty there. And what they found was, and the kids they recruit, almost all of them were pre-diabetic. So they're really coming into the situation with some real challenges. Their motto is growing food and growing leaders is their sort of motto. And so the kids, they learn, they get into the ground, you know, in the way that we were talking about before, and they start eating a lot of the foods that they produce. And what they found, the University of Hawaii did a study on them and found that they had a 30% drop in those who were that were coming in as pre-diabetic. Their A1C levels had dropped significantly. And what was even more remarkable about that example was that they, using their social networks, they looked at the health of the people that they were connected to but weren't participating in the program, and their health also improved. And so one of the messages I just wanted to bring to this group is that you might not think of yourselves this way, but you are among the most important health workers of our time as you engage kids in nature.
Thank you for saying that. I love it. I love it. Can I just give... So I actually worked with the Mao farms, with the kids. So we were looking at the impact of environment and epigenetics and how environment can actually change your genetic makeup, right? And so it's an ongoing study, but it's one of the most brilliant sort of cooperative, community-owned, community-led projects that I know that has both impact in health, but then social and economic and ownership of land, right? And so I hope to see more of those projects like that.
I'm so glad you brought up epigenetics, because I think that's, I just loved saying that, you know, methylation. I love being like the historian banker in the room talking about like cell methylation, you know, but epigenetics is really important. So there used to be this theory about health, that it was produced by good genes, good medical care, and good behavior. Mm-hmm. And it turns out those are all wrong.
Absolutely wrong.
Absolutely wrong. And so the thing about genes, I mean, genes provide a certain set of options, you know, that are possible. And so they matter. They're not insignificant. But they're so powerfully overwhelmed by the environment. That's epigenetics, mm-hmm. right? So if you're in a stressful environment, if it's you're not sure where the next paycheck is coming from, or there's violence in your community, or your body ramps up. And it's what physicians refer to as allostatic load. The effort with your body is trying to kind of keep it at homeostasis. And when you're under a lot of stress, you have a high allostatic load, and that just breaks your body down, right? So we know that if we were to create better environments, we'd create better health, right? That's one. Medical care is important. Having access to it is good, you know, but even in places that have universal access to high-quality free medical care, like the UK, they still have the likelihood of a wage worker is, the likelihood of death for a wage worker is double that of a professional in the UK. And that was true 50 years ago, 30 years ago, and today with all the... So medical care helps. Everyone's a little bit better off, but it doesn't close those gaps. And behavior is almost impossible to influence. What really does it is a sense of connection and a sense of control of your future. If you feel like you've got a future, then you're going to be healthier. And these are the things we know build health. So something like the Ma'au Farms is like, those kids kind of connecting to their culture, their, what I love about, and I love what Mrs. Smith was saying this morning about the work that her colleagues were doing, this idea that in Native Hawaiian, it's the term is aina for land and nature, and and she mentioned it as well. So there's this reciprocity that you have with the land. In Native Hawaiian, it's called kuleana. The kuleana means you have an obligation. So you have an obligation to protect the land, but the land has an obligation to feed you and clothe you and shelter you. And those kids they're tapping into this like bigger concept of who they are and how they relate to the land and their culture and their peers and whatnot. And that begins to give them a sense of wonder and excitement and a sense of control over that they're living a life that their ancestors led and that they'll hand down to their children, and that begins to impart a lot of health, and I think that's pretty exciting.
Health and well-being.
Yeah.
Thank you so much for that, David. And somewhat last question is kind of gearing towards nature and health. Intuitively, we've always known the power of nature and its benefits to health, but more recently, we're getting reports that substantiate this, right? There are publications in the Lancet, JAMA, the American Public Health journals, and more recently, one of our colleagues, Rob Gildrall, he published a document, The Economic Benefits of Green Schoolyards, right? Mm-hmm. One thing that we know for sure across the United States, that every small town, city, rural community, we have schoolyards. Like, schools are everywhere. And optimizing the space so that we go from gray, barren schoolyards to the greening of these spaces has these problem-solving opportunity. That's what it creates. In the report, Rob and Children in Nature Network, the partner to the report, lay out all the benefits, right? The case making for nature. In my line of work, I'm sort of the connector that you talked about, really going out and making the case for nature to those that produce health and those that consume health. Right? And my sweet spot is if we can design communities with the forethought that integrating nature costs us less in the long run, right? And we benefit along the way. What I find difficult is that even in health, right? And we know that like I just said, 80% of our health is determined outside of the exam rooms. But we have difficulty making that transition into investing into nature. How can we get our health colleagues to invest in nature more, knowing that it has this potential to transform us as human beings or to transform our communities? And there's a transactional benefit from that too. There's a return on investment. Can you talk a little bit about that?
Sure. So I always feel like I'm the bad guy in these events because I'm always trying to figure out how you make money at this. But I think there's something really important about that because there was a discussion yesterday about philanthropy. 1.5 trillion total assets for all of philanthropy in the United States. That's chump change compared to the 4.5 trillion in medical care costs each year, and it's a very small percentage of the $30 trillion GDP that we have every year that's generated in goods and services. And so I think tapping in, trying to make a business model out of things has a real potential for good. Because markets are it's just a tool, right? And you can make, the wheel's a tool, and the wheel can deliver, food to a hungry community, or it can bring guns. I mean, it's not the wheel's fault, it's how we use the wheel, right? And so markets are the same way. We can use markets to make better outcomes. Rob, by the way, is an old friend, and he got his start. One of his early insights would it be better to invest in, because cities all over the country build stadiums, and they use public money to do that. And his question was, would it be better to invest in stadiums or children? And so he did a cost-benefit analysis. What's the investment into preschool? We spent the money that we use on stadiums for preschool, what would be the benefit? And he found an almost 17, for every dollar spent on preschool, you would get $17 back from multiple streams, from benefits that would come to those kids. So he's in the business of kind of putting these things into, so I think the work he did on schoolyards is really groundbreaking and really important. I would figure out who owns the downstream medical care cost risk in your community and start talking to them and saying, look, this is the benefits we can deliver in terms of kids showing up to school more, their parents not missing work, those kids not showing up for asthma visits to the emergency department. I think you could start making the case, and I think the health people would see that on some level. But I think it's bigger than that, actually. Like, I think there's another sort of revenue stream that I'd really encourage everyone to think about, and that is, this is not once in a generation opportunity. This is once in a century opportunity by two laws in particular that have passed, the Inflation Reduction Act and the Bipartisan Infrastructure Bill, have created almost $500 billion for investment on green technology and climate resilience, so mitigation and resilience. But 40% of that, by decree from the administration, has to go into low-income communities. And so you can imagine something like there are going to be a slew of new investments into communities and into nature, something like the Boston Urban Forest Plan. That's going to be that billions of dollars are going to be invested into greening cities, into making places, to cool roofs, to creating sort of the kind of climate resilient sort of elements within a community that make them more, that cool down the temperatures, that make those places less likely to flood with all kinds of more parks and things like that. And so there's a huge source coming in that I think this community could tap both into the health dollars, but also into this new these climate dollars as well.
Thank you so much. You know, as I was reading the book, I was thinking about the green schoolyard models, and we would want them to be guardrails, right? We would want them to kind of help us, you know, shape as preventative measures. But then as we're talking about extreme heat, urban heat islands, unfortunately, we're also needing them to be airbags, right? The environmental airbags to further, exposure or harms from heat exposure. And I'm wondering, as these allocations are coming to states and cities, are people thinking about green schoolyards in that way?
We were just having this conversation. I was having this conversation with Sarah earlier. There was a proposal in Washington, D.C. Their sewer system was reaching its capacity, and they were going to have to start. The city had proposed that they were going to start building all these concrete channels to sort of alleviate the problem, and a counter proposal was made to just build more parks in D.C. And the impact investing firm called Quantitative Ventures really put this. It was a bond, they put a bond together, and they said, and they actually just put it like a flywheel in the sewer, and they basically said, okay, if you can reduce the flow by your approach using parks instead of concrete channels, we'll pay you what we would have spent on the channels, and this will pay for this. And the flywheel slowed down because the parks worked. They were able to filtrate that much water and alleviate the sewer system. And so I think there are lots of instances. I would be curious if we could find a way to put together some kind of a green school yard bond and try to figure out if it boosted attendance in school, if it reduced the number of asthma visits to the emergency department. We could find some funding stream like that flywheel that slowed down, some way to measure the downstream, that's literally downstream, of course, but some way to sort of measure the benefits of those schoolyards, because we know they exist. And I think there are ways in which we could sort of build the case and then attract the capital.
Great answer, thank you. Thank you so much. I told you he's solution-oriented. This is not in the book, but I wanted to share like a transformative example rather than, nature being transactional for this. A project that I did in Washington State, and that's working with a health system that covered 9 counties. The hospital system was hemorrhaging billions of dollars each year for rehospitalization for populations that were, ailing from chronic diseases, comorbidities, often high blood pressure, diabetes, and it was among the elderly, and then gestational diabetes among young childbearing people, and undiagnosed children, but certainly exhibiting signs of diabetes. So the hospital was afraid that they may have to shut down, and they were a safety net hospital. On the other side of the formula was the community, right? First generation migrant workers, young women who were not accustomed to eating the low quality food that the towns were, offering. And then I came in as sort of the connector to figure out a solution for the hospital. And then I walked around the hospital. There was no park. And I expanded sort of my radius, like a mile, 2 miles. It was this old beat up park. The swings were like, torn off, and no nets in the basketball court. But there were people just hanging around, like just wishing that the park could be more. So I went to ask. I was like, hey, what are you guys doing here? Oh, this is where we come to hang out after work, right? Then also I looked at the social demographic. There was high level of domestic violence, substance use, and the I think life expectancy in that particular community was 3.5 years lower. Just broke my heart. So I went to the hospital system. I was like, are you looking for a transactional solution, or you want to transform the community? That didn't make sense to me. We have to be realistic sometimes. Hospitals are not in the business of, people being healthy, then they would be out of business. But that's a long way to come, right? And you really cannot convince those people that make the decision of how to invest in communities when they're hemorrhaging dollars. So you really have to be creative. You have to look at data. So what I said, I was like, hey, why don't you invest in this park over here? It's going to change the social connection with the people. It's going to decrease substance use, domestic violence. It's going to improve the gestational diabetes. So you're actually going to have healthier children who are going to come into the community. And guess what? Your rehospitalization rate for the elderly is going to decrease by 50%. I don't think he believed me. So I came up with some predictive models to just demonstrate what that would look like in just 3 years. For one, the park became a site for intervention. So we created jobs. Community health workers who were of the community, from the community, knew the population, were paid from the hospital's community benefit investment, which is grants, right? But we needed the hospital to dig deeper into their portfolio of investment coffers, right? Bring out $3 million, $5 million, invest in the infrastructure, green and social infrastructure. Train the community health workers and across the health indicators that were troublesome to the community in the hospital. And work with the medical providers that, if you want to do park prescription program, it actually has to be really intentional. It has to be around disease. It has to be very controlled. You have to know how many miles the patients have to walk from their home to the clinic. And you have to give them a prescription. If you walk X amount of time per month or per week, this is what, the results will be. So there's a lot of work. It's hard work. But after 3 years, guess what? The hospital's rehospitalization rate dropped by 0.01. They began to save $1.2 billion. And they only spent a fraction of that into the park, which is $2.7 million, and I think $900,000 in training community health workers, 37 community health workers who were able to get certified as, I think it was, it's community health workers, but there was a certification, diabetes management associate, and then some other, right? But to me, those are transformative, types of changes that we can center nature on, right? We didn't even begin to capture the benefits of nature, just the transactional that David was, deals that we make. If you invest in this, this is what you'll gain. And sometimes you do have to do that, right?
Yeah, no, I love that example, and I think the one you mentioned is the medical provider was also the insurer. Is
yes.
that right?
Yes, they are. Yes.
Yeah. So that's a great example. So it's what they call integrated health systems.
Mm-hmm.
That's a good partner to have because
Yeah.
their incentives are aligned.
Mm-hmm.
So like Kaiser Permanente, for example, is one of those, and they invest heavily in affordable housing around their hospitals because they know that's going to save them. Not only do you make money investing in affordable housing, it's not a bad investment, but you also their patients are healthier because they're stably housed. And their policyholders are also their patients. Maggie Superchurch in the book has this quote, and I do love that name, Superchurch, which I thought was like the coolest name ever, but it's just Maggie Super married Bruce Church, so it's not that interesting, really. But Maggie Superchurch has this quote in the book. She says, "Why can I invest in a pill that lowers blood pressure, but I can't invest in a neighborhood that does exactly the same thing, measurably the same thing, which you just demonstrated?" So there's lots of ways you can make business models out of this, and I know we're closing soon, but I would really encourage you to find in your communities that there will be a community development financial institution in your community. These are nonprofit banks. They are profit-driven, but not profit-maximizing. They are on your side. They see the value in nature and parks and the work that you all are doing, and they can help you do something like Hanaa just described: solve somebody else's problem, create a cash flow, and then find a way to make the money flow to where it's needed. And so, and if you're also near wherever you are, you're near a Federal Reserve bank or branch, and I'd really encourage you to get in touch with the community development team there, and I'd be happy to connect you with them also, because building those relationships in order to build those transactions, it takes a while to set them up, but once they get going, it can be really transformative.
Thank you so much. I love that. And so I would be remiss if I didn't actually explain the role of the CDFI that we work with. That's LISC and New Jersey Community Capital. And what is a New Jersey Community Capital doing in Washington State? We developed an earlier model around another hospital, RWJ. Barnabas invested in a park that was also used to generate garden, like fresh produce, right? So we developed that model, and then we're testing it out somewhere else. And what the CDFI did is they took the hospital's grant dollars from the community benefit, right? And then they created a PRI, program related investment, yeah, so that they can maximize those grant dollars for sustained use, right? And you're like, well, that's interest. How do you pay that? And parks don't really generate, income. But the hospitals do, right? The hospitals benefit. There are other tax forms that, we did, I think it was a new tax credit from one of the clinics that was developed around the park. The opportunities are there for us. The money is there for us, and the partnerships is there for us. I think it's for the health people to get out of our own silos and begin to really practice what we preach, that health, 80% of our health happens outside of exam rooms and hospitals. And then for us nature people to start, expanding our partnerships into other sectors, right? And continue to push forward. And and from what I learned about David, is to reimagine sort of these non-linear relationships and to be persistent.
All right, let's go do it.
Thank you. All right. Thank you so much, David.